marked. She is full code, hospital day number 3. This is our 23-year-old G1P1 female with history of insulin-dependent diabetes, admitted with diabetic ketoacidosis postpartum, and a headache felt consistent with post-dural puncture from her epidural. 24-hour events, Toradol, Dilaudid, Furoset did not really help her much with her headache. Her anion gap closed last night and is now down to 10. Total insulin in the past 24 hours was 32 units. Symptoms-wise, she states her headache is still 5 out of 10, down from 8. Continues to have mild photophobia. She has remained in bed because sitting up still worsens her headache. No vision changes, paresis, or paresthesias, and no fevers, chills, nausea, or vomiting. She had 32 units of insulin yesterday and 60 on her first day, and then 45. Observations, her Tmax was 36.7, heart rate range from 85 to 104, most recently 100. Blood pressure 130 to 154, 85 to 102. Most recently 130/85, respiration 16 to 18, statting 95 to 100% on room air. In general, she was awake, alert, oriented to person, place, and time, well developed, no acute distress. She appeared more comfortable lying in bed today, but still said she wanted the room dark. Heart was regular, rate and rhythm, no murmurs, rubs, or gallops. Lungs were clear. Her lower back continued to be tender to palpation over her paraspinal muscles. Extremities had no edema and there were no skin lesions, and she has one peripheral IV that is not red or tender. Neuro, she wouldn't let me check her pupils, but motor strength and sensation to light touch was normal throughout. Labs, white blood cell count 9.3, down from 14.1. H&H was 9.3.
Mrs. Knowles is having chest pain. I started her on oxygen and started KP.
Okay, thank you for letting us know. Ashton, can you go and please evaluate her?
So H&H was 9.3 over 27.7. 27.7 is up from 24. Platelets 294, up from 261. Chemistry, sodium. Imaging, MRI from 2 days ago was staph read as diffuse contiguous dural meningeal enhancement. So assessment and plan, number 1, her headache is a little better but still 5 out of 10, constant throbbing and located in a band-like distribution around her head with a positional component. Symptoms are most consistent with post-dural puncture headache, especially given MRI findings. Unlikely infection giving resolvent leukocytosis. She remains afebrile. Muscle spasm in the neck and back could be contributing to. She's MPO in case we proceed with a blood patch this afternoon. The Dilaudid and Imitrex aren't helping, so we'll stop those. For back spasms, we're now giving cyclobenzaprine 5 milligrams TID, and we'll switch to 10 milligrams.
So do you want to get another LP?
We could consider it if she gets worse or has a fever, but I would hate to worsen her headache with it now. Number 2, diabetic ketoacidosis is resolved. Anion gap closed last night to 10. We'll check a BMP this afternoon. Hemoglobin goal is greater than 7 for transfusion. Number 3, ID. She's on no antibiotics. Leukocytosis resolved. We'll follow up on the final culture reports. DVT prophylaxis is Lovenox. And Dispo, continue to monitor her on the floor overnight, and if her headache improves, then maybe she can be discharged tomorrow. Good. Should we go see her?
Sure, sounds good.
Hey, that's me. We got to get out of here.